All right, so there's a few other factors that I think are important to bring up in terms of the preschooler. The first thing, and this is true of development throughout the childhood years, is that development is asynchronous. That means that the normal developmental progression is uneven. Some kids are going to jump forward cognitively and their language will fall off. Or they might develop gross motor at an amazing pace and fine motor's lagging behind. And that's typically the case. They may also jump forward with all motor, but their grasp of concepts or their ability to self-regulate may drop off. So we don't expect with preschoolers that everything is going to happen all at the same time. We see this, and again, I'm trying to introduce a little bit of atypical development just to kind of prime you for that, because that's where we're headed ultimately in occupational therapy, is looking at the needs of those who are not developing typically. But this can be seen, this asynchronous development, in children who have cerebral palsy. So they have intact cognitive skills, but they have a significant amount of motor impairment. And so their cognition may move forward, but they're held back because of the inability to move in, like we were saying, a fluid, force-regulated, enduring way. There's a new term that we want to just introduce. It's a little bit off of left field, but it's in your presenter notes, and that's learned helplessness. And that is a state where a child with a disability or an adult learns that there's no way to succeed because they've repeatedly experienced failure. It can happen due to disability. It can happen due to a variety of other factors in a person's life where they're constantly met with failure. And so they learn that that trying is not going to help. And so they become very passive and resistant to trying unfamiliar tasks. And with the child with CP or other disabilities, sometimes by the time they get to therapy, they have some learned helplessness. And part of our first goal is to help them bust out of this reluctance to engage in new tasks. So just a little new terminology, and we'll probably be revisiting that as we go. All right, so throughout the lifespan, of course, culture is going to influence development. When we think about our preschoolers and kids in general, here's some of the areas, and it's not an exhaustive list, but something for you to start thinking about when you are thinking about case studies, when you're thinking about clients as you move through this program, etc. So the first is that beliefs about the developmental process vary from culture to culture, of course, right? There are cultures that believe much more strongly in early independence, and certainly the U.S. is one of those. There's other cultures that believe more strongly in interdependence, and really are fine with supporting and doing for their young children to a much later age. Now, do these children turn into adults who cannot wipe themselves after toileting or feed themselves or manage their food containers? Absolutely not. But the push to be independent is not universal. So independence versus interdependence. There's also authoritarian versus egalitarian kind of approach to life. So the authoritarian approach is a preference for obedience to a clearly identified authority. So that has to do with family structure and power structure, both in the family and without the family. Outside the family, outside the family. And individual freedoms are not viewed as very important. Contrast that with an egalitarian approach, and the preference is for affirmation or promoting the individual. It allows for negotiation with authority and considers individual differences. So this can be seen a lot in parenting style. Family membership characteristics or family structure is another area that culture influences. It includes things like the number of children, the number and marital status of the parents, the relationship to extended family members and intergenerational family, the presence of live-in family members that may or may not be related by blood or marriage, a traditional or less traditional family structure. And the family structure can shape the response to a child with disabilities. So different cultures view disability in very different ways. And, from a continuum of no stigma whatsoever to really intense stigma. And it then impacts how they deal with a child with a disability within the family. And then finally, there's ideological styles. So that includes things like beliefs and values and coping styles, whether you cope internally or whether you externalize your coping skills. So we will revisit this more, but it's a slide that I hope gets you thinking about some of these factors in addition and kind of layered on top of all of the developmental domain information. All right, and then related to that, but more focused just on the family function, that can affect development in some pretty profound ways as well. Socioeconomic status, or SES, affects daily needs and the provision of resources and a whole lot. We know that poverty is really, really bad for humans, and it's especially bad for children. It forms a cascade effect that pervades every area of development and accompanies that child through every phase of life. Another aspect is attachment between and among family members. And again, Ainsworth is our attachment theorist. There's the initial attachment. There's budding or attachment in the making. There's active attachment, and then there's multiple attachments. And that the family structure really affects how that happens and who the child is attached to. Also, time use, routines, and habits affect kids and affect development and vary amongst families. One way to think about it is Maslow's hierarchy of needs. For example, if the family is struggling to meet their physiological or safety needs, there's less energy, time, availability to address other needs within that child. Also cohesion, which is how family members interact with each other, and the emotional bonding that may happen or not happen within the family subsystem. And finally, adaptability is an important factor to consider in terms of the family's ability to work together when change or stress occur. And rigid families have a high degree of control and structure, and their interactions are governed by specific rules. And those rules tend not to be very flexible. Chaotic families have a low degree of control and structure and few rules. And, children actually thrive from a level of structure. If the structure is suffocating, that can be problematic. But on the other end, if the family dynamic is very chaotic, the child who is learning about everything in the world doesn't have boundaries from which to base their perspective and to learn and to push off of. So balancing the amount of structure in a family can be very important, and different families do it in different ways. All right, I leave you with a quote from Mr. Rogers, who said, "Play is often talked about as if it were a relief from serious learning, but for children, play is serious learning. So when you think about your preschoolers and doing anything or developing in any way, you always want to bring that play piece along with you, because kids are learning through play, right? And the primary job of a kid is to learn new stuff. Play is the number one way that they do that. When we meet in class, we're going to do some preschooler observations. We're going to be watching videos of typically developing preschoolers, and for the first time, since we've done some observation, we're also going to look at children with disabilities. You can preview the videos of the children with disabilities on one of the next slides. I will get you right there. Okay, so I'm going to show you that slide, but we're going to do observation in class. So we'll talk a lot about that, but basically, one of the foremost tools of the occupational therapist is the ability to observe and assess and then analyze behavior to figure out what's not working well, and then formulate a plan to either adapt to it or remediate it. In other words, change it. So that's why we're doing so much observation. All right. Resources. I have a nice preschool resource for you. It's from the CDC. You can find the link in the slide deck, and I encourage you to go there and have a look. Kindergarten readiness resources. If you reach out to me, I will send you my kindergarten readiness booklet. There's also a number of other checklists so you can see what exactly is the goal of the preschooler in getting ready for school. Here are the video links for the preschoolers with disability. We'll look at autism, CP, and Down syndrome. And that concludes our lecture for today. I'll see you soon. Thanks for watching. Bye.